Miss Jennifer Jones. I'm 48 years old. To be honest, I've never ever visited a hospital before this. I'm very active in sports. I regularly play badminton 5 days a week, and I play twice football. Until early last week, while during these playing sessions, I started being uncomfortable in breathing. But I thought it must have been gas or any other issues to do with gastric, so I ignored it at that point of time. It just began to get worse by the day. So I took a couple of days rest. This week, where I went to play badminton, I played for a couple of minutes. My hands and legs got really cold. I started sweating and I immediately stopped playing. Called my son over to the court. He took the kid, dropped me home. Then I was struggling at home. Then my wife then wanted to rush me to the hospital. She was heading to NH, to be honest. And I heard about Kauvery because they used to visit our community during the COVID for camps. And we came in here and I was rushed to the ER. And there was this very nice gentleman I first met. He put me on an ECG immediately. He got the report, he looked into my eyes and he said, "Trust me, Jones, you'll be fine." I think that gave me some bit of confidence.
So he came to our emergency department with acute chest pain. He was found to have acute heart attack. He was taken up for an emergency angiogram immediately, and the angiogram unfortunately revealed a very diffuse triple vessel coronary artery disease. That means he had blocks in all the three blood vessel systems of his heart, and it was extensive. The only option was surgery, that is coronary artery bypass grafting, or CABG as we call it commonly. The challenge here was twofold. One was medically. In such extensive diffuse triple vessel disease, the surgery is very technically challenging. To do such a technically challenging surgery in a patient who has had a recent heart attack, it requires a lot of skill and teamwork. And secondly, we had to tell the diagnosis and the problem to this young individual who has had this problem for the first time. He had to be told about the nature and severity of the disease, and also that he required surgery at the earliest.
And that's a decision later my brother, my wife and doctor took, since I was in a condition at that time to be a part of the decision making. The night before the operation, I was a bit anxious. I think the staff here, every one of them made me feel comfortable. They did allow close people to stay with me through the evening so that I was in good shape.
We were able to do the coronary artery bypass grafting using the beating heart technique itself. With skillful management, he didn't require any supporting machines like IABP or heart-lung machine.
The operation went off really well, and in about 6 hours operation, I was out of my ventilator in about 7.5, 8 hours. I was breathing on my own, and next morning I started walking as well.
Once the blood supply was restored with the bypass operation, his heart function improved significantly, and subsequent his recovery was routine.
And today I'm getting discharged, which is day 5. I'm eternally grateful to every single person in Kauvery for helping us out, not just in taking care of me, but my family in regards with whether it's the processing of the insurance or any administrative work, because my wife did all the running around and the team supported her in every single way. I really want to thank each one of you.